Today, my lecture about in medicine. The topic name is Parkinson disease. So today I will talk about the Parkinson disease, what's the pathology and what's the pathophysiology and what its clinical symptoms and what its treatment. So today my main focus will be on the pathology of the Parkinson disease and then treatment. So actually the Parkinson disease, how we classify and how we study the Parkinson disease. Actually, the definition of Parkinson disease is that there is a progressive clinical syndrome due to the lesion in basal nuclei and the destruction of dopamine neuron. So that dopamine neuron is a stimulator of cerebral cortex. So that neuron present in the substantia nigra of midbrain. So if this problem occur in the midbrain, the substantia nigra. So substantia nigra contain a dopaminergic neuron. So if any lesion in the midbrain, it can damage the dopaminergic neuron. So that syndrome characterized by resting tremors, hypokinesia. This is a main feature of this Parkinson disease, that patient develop resting tremors which occur during rest, and hypokinesia or bradykinesia, that patient unable to initiate his gait movement. So this is a major symptoms of that Parkinson disease. Now let's talk about what's the pathology of Parkinson disease. Actually, Parkinson disease is the slowly progressive and disease. It can be genetical and the loss of dopaminergic neuron. So actually, when there is a loss of dopaminergic neuron, so increase the acetylcholine activity. So when there is a acetylcholine activity become more, so it inhibits some movements, like it less movement, difficulty in speech and swallowing, because the dopamine is the one which stimulates the cerebral cortex. So in that disease, when there is a loss of dopaminergic neuron, so you can see in the age, it occur more than 50 years, most commonly more than 50 years of age. So in that disease, what happens? There is a loss of dopaminergic neuron and the increase of acetylcholine. So it inhibits these movements. So this is an important thing. Okay, so that acetylcholine also can cause resting tremors, and it can cause less movement and difficulty to initiate the movement. Then what's the components of basal ganglia? Actually, these are the components which make the basal ganglia: caudate and lentiform nucleus, and then there is a subthalamic nuclei and substantia nigra. That substantia nigra contain dopaminergic neuron. So that is the component of the basal ganglia. Now I will talk about what's the structure. Actually, this is the base of the brain, and this is the midbrain part. This is when non-Parkinson disease, there is not presence of any Parkinson. This is a proper substantia nigra cell. But here you see there is a loss of substantia nigra cell. When there is a loss of substantia nigra cell in the midbrain, so it can cause Parkinson disease. So Parkinson disease actually in which there is a loss of dopaminergic neurotransmitter. So that neurotransmitter is responsible for the activation of cortex. When there is a no dopaminergic neuron, less stimulation, so acetylcholine will be increased. Now I'll talk about what the causes of Parkinson disease. So actually the Parkinson disease causes can be idiopathic and can be a methyl. This is a drug addiction like heroin. So it's like a drug addiction, and like drug metoclopramide, it's also an antiemetic drug. Actually that drugs block the D2 receptor. When D2 receptor block, there is no dopaminergic stimulation, not release of dopamine. So actually when we are taking any antiemetic drugs, so that drug block D2 receptor, so they also eventually they also block D2 receptor in the brain, in the basal ganglia, and head injury and viral encephalitis. So these are the major causes of Parkinson disease. So idiopathic drugs like antiemetics and like a heroin addiction drug, and head injury and viral encephalitis. So I just divided my lecture into 2 to 3 videos. So in my next video I will talk about the further. So just stay continue on it. Thank you.